alaikum, APPNA members. Welcome to APPNA Cafe. This is Dr. Sana Imran, member of the APPNA Communication Committee. It is truly a pleasure to be with all of you for episode 4 of our series. So at the APPNA Cafe for the past few episodes, we've been highlighting our incredible subspecialty committees like APCNA and APGNA and the leaders who are shaping the future of medicine. Today, we're highlighting APPNA Pediatrics, a specialty committee which is dedicated to advancing pediatric care, fostering mentorship, and strengthening professional collaboration within our community. It is my honor to introduce our guest, Dr. Safdar Sultan Khan, the current president of APPNA Pediatrics. Dr. Khan is a neonatologist at Nationwide Children's Hospital, where he also serves as the director of the outreach program for Central Ohio Newborn Medicine. His leadership extends beyond clinical excellence. Previously a faculty member at the University of Miami, Dr. Khan continues to expand his expertise and perspective as he pursues an MPH at the Harvard Chan School of Public Health. Dr. Khan, welcome to APPNA Cafe. Thank you so much for joining us. We're honored to have you with us today.
Thank you, Sana. Assalamu alaikum.
So can you tell us a bit about yourself?
Sure. So I was honestly born in a small town in Gujranwala, Pakistan. I did my medical school from Rawalpindi Medical College, now University, as you know very well. After graduation, I did house job at Services Hospital, Lahore, worked there as medical officer for a year or two, and then also worked briefly at Shaukat Khanum Hospital in pediatric oncology. And interestingly, that was the time I became more interested in peds when I worked at Shaukat Khanum. So then I moved to US for my residency. I did my residency at Cook County Hospital, Chicago, and did my fellowship at University of Kentucky. And during fellowship, I became interested in translational research, and that resulted in a master's in translational research. And then I accepted, as you mentioned, my first job at University of Miami, Florida. And I lived there for 7 years because I was fond of warm, nice weather. And then my wife threw a curveball on me and she accepted a job in cold Ohio. So that's why we moved to Ohio, and I have been with Nationwide Children's Hospital for the last 3 years. And we have now kind of settled here in Ohio.
Wonderful.
And before I stop here, I would also mention that I worked as a secretary APPNA Peds for 3 years. The person who brought me to APPNA Peds was one of our local chapter from South Florida, Dr. Maureen Siddiqui. She introduced me. And this was, remember, this was a Corona time.
Yes.
nobody wanted to work. So we kind of found other things, and one of them was APPNA Peds. So then after 3 years of working as secretary, then I was elected as president, and I am president for 25-26.
Wonderful, wonderful. So for our members who are not very familiar with it, can you briefly share what APPNA Pediatrics is all about and what its core mission is? When was it formed? How many members are a part of it, and all the meetings and how often the meetings are?
Sure, yeah. So APPNA Peds is a specialty chapter of Central APPNA. It was founded in 2015, like many other specialty chapters, by a founding member committee. There were many founding members, and I think if I have to name one, Dr. Khalid Kamal was the pioneer, bringing all us together. And there was a whole team of founding members. The list is pretty long. And then after Dr. Khalid Kamal being the founding president, and then we have Dr. Riaz as president after him, then Dr. Aisha Najib, Dr. Maureen Siddiqui was immediate past president. So we are now a decade old, and we have our own bylaws, we have our own structure, our own committees, but all under the umbrella of Central APPNA. And annually we meet during the summer APPNA meeting. We usually discuss our, strategic planning for the year, for the next year. And now we have moved to every 2-year cycle of election cycle
Okay.
from recent changes in bylaws. So overall, we have grown in the last 10 years. Now we have more than, so there are two different categories of members we have. There are trainee members, which is free of charge. Any trainee in North America can become member. And then we have registered members, which have voting rights and you can chair a committee, etc. So those members have grown now more than 130 around.
Oh, wow.
Yeah.
Okay. So there are
Yeah.
130 like total members in APPNA Pediatrics.
Yeah, the registered members, and that excludes the member which are trainee members.
Okay. Okay. Awesome. And then what is exactly like the core mission of APPNA Peds?
If I have to summarize the core mission, I will say three things. I think the main thing is the education, advocacy, and collaboration. Through academic programs like training initiatives, partnership with institutions in Pakistan, and even here in the US. So the aim is to strengthen pediatric care, improve knowledge exchanges across continents.
Yeah.
And
Yeah.
ultimately, yeah, the goal is very simple, to
Yeah.
translate knowledge into better health outcomes for children here
Yeah.
in US and back home in Pakistan.
Wonderful, wonderful. No, I'm extremely impressed. I was also going through a few, YouTube, and we'll come to that. There's like a whole YouTube channel on APPNA Peds, which is not just an educational platform, but it's really like, a community that's helping, pediatricians, across like the US and Pakistan. It helps pediatricians connect. It's also like very important for like, mentoring the next generation, better care for children. So very, very impressed with all the work that you guys are doing. So tell us about how APPNA Peds will affiliates with like, Central APPNA.
As you know, the Central APPNA is a huge, big umbrella and a huge organization that represents physicians across specialties.
Yes.
And specialty chapter, honestly, they add an important dimension to that structure. And I'm a strong believer of that. They provide another layer of engagement for members who want to connect in ways that align, closely with their professional work.
Yes.
For a pediatrician, for example, the professional needs, the academic interests, and even the networking priorities can be very different, imagine, from a surgeon,
Yeah.
right? So we have very
Exactly.
different needs for connectivity. So in that sense, I will emphasize that the specialty chapters allow those connections to develop in a focused and meaningful way. And another important benefit is that the specialty chapters cut across alumni lines. And I am a great fan of that because I feel that, imagine if you are from a small alumni and you don't have alumni chapter, or you live in an area there is no local chapter even.
Yeah.
So specialty chapter is another avenue you can join, and
Exactly.
that can provide you engagement within professional organizations and can become centered around institutional affiliations. So I think in nutshell, specialty chapters provide an opportunity to move beyond those silos we live in,
Yes.
because as you know, for example, we have members in APPNA Peds from California, from Florida, from Doe, from RMC, from King Edward, so all across Pakistan, and even
Yeah.
from US, like some of the medical schools from US. So I especially I think that people join APPNA for different reasons. Some join for networking, some join for academic collaboration, some
Yes.
for mentorship, and some simply because they want to make friends, and some are looking for life partners. Just I mean, there are so many reasons people
Yes.
join,
Yes.
uh, and specialty chapters is another layer and opportunity for those who are mainly focused. I want to be engaged just professionally and in my field, and I want to do something which can deliver on the ground. So this is a great avenue to be involved in through the specialty chapters. And I will also say
Wonderful.
that if we have more time, is that one perception which sometimes discourage people from engaging in professional organization is the belief that participants mainly come for self-promotion and
Yeah.
self-visibility. And
Yeah.
the best way to change that perception is through real work. And specialty
Exactly.
chapters provide that kind of direction, I feel, and where the
Yeah.
initiatives can be impactful. As I was reading some of the interview, like listening to some of the interviews. People have been doing amazing work in specialty chapters, not just the APPNApeds. I'm talking about other
Yes.
specialty chapters as well. So
Yeah.
let the
Yep.
work speak, because what they say,
Yes.
actions speak louder
Yeah.
than words.
Exactly. Exactly. And I also feel that, a lot of like the work, I'm glad that we're doing, the APPNA Cafe right now, because I feel like, this kind of work that's been done is not really getting the recognition that it should be getting. And, a lot of people are, discouraged from APPNA. They're like, we don't know what kind of work is going on, So I feel like, with APPNA Cafe, we have like, this is going to be on social media. It's going to reach a lot of people. So they're actually going to like, see the amount of work that goes into, all this. So I'm glad that,
Cannot
you're
agree
here as
more.
well and you're talking to us about this.
Yeah, no problem.
So what are some of the key initiatives or programs that APPNA is currently working on and that, have had the greatest impact on members?
That's a tough question. Okay, but let me try. Let me try. So I think to answer your question, what initiatives APPNApeds is working on, I can walk you through different committees we have and what things they're doing. I think in this way we will probably cover more comprehensively what we have been doing. So we
Yes.
have like 10 core committees and 2 ad hoc committees in this election cycle. And I'm going to just highlight, some committees are just usual committees like Cable Committee, NEC, and people know how they work and what their role is. But I'm going to highlight some of the committees which are doing, not to minimize any other committee, but like which are doing some relevant work. One committee is New Medical Graduates Guidance Committee, and in this we help pediatric residency applicants to find observerships. And we also, in under that committee, we have pediatric interest groups in medical colleges in Pakistan. And this was idea actually one of the medical student, Dr. Zainab. She initiated from Dow Medical College, and we liked it, and we wanted to expand to other medical colleges. So that is something we have been working on. And then our committee, the graduate new medical graduate committee, some of our colleagues have structured observership program. For example, Dr. Nasser Rashid is running a structured program. They just select candidates, they interview them, and then provide those observership opportunities. Similarly, Dr. Raza Mahmood and Dr. Muhammad Ali Sayyid, and then there are many more people helping. Honestly, it will be unfair if I miss anyone, but we don't have time to go through the whole long list. And then we have a resident education and training committee, where we help the applicants which match into the residency program to strengthen their training. For example, to help them find fellowship, how they can build their CV towards fellowship. And we also help them to prepare for board exam questions. We actually prepared many, like recently we prepared content for pediatric residents here in US and Pakistan, which had like more than 5,000 questions with explanations and the article links, etc. So we strengthen them in their training. And then we have a committee called Research and Early Career Development Committee. Their role is mainly to basically help people after you're done with your training, whether you are in academic track or private practice, so you can transition easily towards that direction. And if they need any guidance and help, so we have folks, in that committee, they can help and guide. We also have an advocacy committee, just like the Central APPNA does, which the focus is mainly child advocacy here in the US and back home in Pakistan. And right now, Dr. Mabeen Rathore is chairing that committee, and we have, done, for example, wherever we see the plight of children can be affected, and we can be impactful, we try to advocate for those issues. Then the next committee, which I am very thrilled about, and one of the reasons I became interested in APPNApeds is Innovative Health Education Committee, because that was my primary interest. Because public health is my primary interest, and I'm doing masters in public health also. So Innovative Health Education Committee, basically we try to create content in local languages in Pakistan for health education, especially for maternal and child health, like in Sindhi, in Pashto, in Punjabi, and in Balochi. So we have been working on, and the plan is to expand it and more institutionalize it, because we have an agreement with University of Child Health Sciences, and we're going to expand on that. And in addition, in ad hoc committees, we have a neonatology committee, which is one of the very active committees. Dr. Nasser Rashid is leading that committee nowadays. We have collaborated with academic neonatology community back home in Pakistan. What we do, Sana, is we do like monthly lecture series, sometimes journal club, where a fellow trainee from Pakistan presents an article. We also assign a mentor with that person. And we have been doing it last whole year. We have been doing, and we're going to continue to do that. We also ended up doing a virtual conference, a neonatology conference, where we had folks from here, US, and from Pakistan, and that happened in December. Then we had a conference in collaboration with Pakistan Pediatric Association in Quetta, where we joined virtually. So those kind of activities happen. In addition, we do weekly PICU round. That was an initiative started by Dr. Mehreen Siddiqui, where folks from Pakistan join and discuss cases, basically who are pediatric ICU patients. In addition, recently we have been very enthusiastically working on guideline development, pediatric guideline. Pakistan doesn't have their own ground-based guidelines. And we are lucky to have Dr. Amir Imdad. He is expert in proper methodology to develop guidelines. So he has been training folks at University of Child Health Sciences in collaboration with Pakistan Pediatric Association. So our plan was, in March, which that we postponed this conferences because of the situation, to present first of those guidelines. But now we're going to do some other month. But I think that's a huge endeavor we are pursuing, and very exciting. And the feedback I'm getting from the people involved, they're very excited about it, that this is the first time we have been doing. In addition, we have focal persons, because, PEDS has its own world. There are like subspecialties in PEDS, like pediatric pulmonology, pediatric cardiology, gastroenterology, etc., etc. So we have focal persons for each specialty in APPNApeds to address someone who is interested in a fellowship, has a question about a particular subspecialty, so that person can help. And lastly, I will stop after mentioning that we last year signed an agreement between Pakistan Pediatric Association and University of Child Health Sciences to work on 3 areas. Number 1, every year we will have a CME accredited conference in Pakistan, supervised by Pakistan Pediatric Association, APPNApeds, and University of Child Health Sciences. Number 2, to improve resuscitation standards in Pakistan. And I will come to that point later on as well, why we need to do that. And then the health education content creation. We are trying to build a studio in University of Child Health Sciences where the whole purpose of that studio will be to just create content, basically to address common sense health education issues for people who are basically underprivileged, and they can get benefit from that information. So this is a kind of nutshell. I may have missed some points what we do, but I think these are probably the key highlights what we do.
Well, thank you so much for highlighting all this. It just pretty much tells us that, the program, is not just, focused on activities. It's basically, doing something or creating something that's going to last, for a lifetime and probably help a lot of members. And, that's exactly why, we're highlighting these specialties, just to highlight the importance of so much meaningful work that's happening behind the scenes, which probably not a lot of people know about. But I also really, really appreciate how, APPNA Peds has expanded its impact beyond the US, and how, we're supporting pediatric education and, all this child health initiatives in Pakistan as well, which is extremely important. And that kind of global collaboration is extremely, extremely meaningful. So thank you for that. So from your experience in APPNA Peds, what are some ways that we can improve membership engagement and grow participation?
You want honest answer?
Yes, absolutely honest.
Okay, so here's the honest answer. I think membership grows when you become member, it adds value to their time and energy in return. If being member does not add value and does not create a sense of purpose, then it is very difficult to bring members under fold. One way to encourage is by creating opportunities for members to contribute to specific initiatives which we have, committees, educational programs. But more important is the communication. I think, as you have noticed, that APPNA does a lot of great things, but it still have negative impression on many due to many reasons. And I think I feel like the communication is the key. People, and you guys are doing amazing job. I think that is why this is so important, this series, the APPNA Cafe series. And then we should, utilize digital platforms for the members to stay informed, share ideas, remain connected when they live in different regions. Some people, they just don't know what we are doing, honestly. And if you tell them this is what we're doing, I usually get very positive response, and they usually want to, okay, yeah, I want to be part of it. But what truly drives is the purpose. When members see that their time and effort contribute to meaningful goals and makes a difference in other people's lives, then participation grows naturally. You don't have to even put a lot of effort, honestly. It grows because people see it.
Exactly. Okay. And, we'll just talk a little bit about the APPNA Peds YouTube channel now that we've touched on, improving membership engagement. So, kudos to you for doing that. The APPNA Peds YouTube channel, there's medical education, USMLE preparation, there's residency guidance, board exam tips. I've been through all those videos, and I wanted to really commend you on that. So, I really encourage all of our members to visit, the APPNA Peds YouTube website, subscribe, share content with trainees and families, because this is exactly, the kind of meaningful outreach that strengthens our community.
And Sana, thank you for saying it, because we want to get 500 subscribers so we can get monetized.
Okay. And then we'll talk about another important, pediatric topic that, we wanted to highlight this month, which was autism. Since March is Autism Awareness Month, and, given your leadership in community health education, how can APPNA Peds help raise awareness about autism, around early recognition, around early intervention. If you would like to elaborate on that.
Yeah, autism is extremely important for public awareness, particularly in regions where developmental services may be very limited. Professional organizations like us, APPNApeds, we can contribute by promoting education for both, not only just for the providers, but also for the family. And let me tell you, not just the autism, any child disability early on, could be cognitive disability, motor disability. It is so important that you pick it early, because the first 3 years of life are the golden window. You can actually change the course by early intervention. So that is one point I will emphasize. I honestly believe, and I'm speaking from my heart, that Desi families, the subcontinental families, our genes are primed to be stimulated more early on. Remember, our child born in Pakistan or even in India get a lot of stimulus. There are uncles, aunts, there are so many people talking to the child is playing outside. Our genes need that to meet our full potential when we grow up. When we come as first generation Pakistanis here in the US, we miss that many times. The parents miss that component. So it is so important they get engaged and connected and don't live in silos, especially if they have a child. The child should be exposed early on, especially for 3 years of life. And that stimulus actually can change the course in terms of development, cognitive development and motor development, fine motor, gross motor, or so many other areas or domains. So what we can do is, through this, for example, YouTube channel, this is one of the purpose. There are so many so many things you can actually make impact by not spending too much money. Just promoting health education is one of them, and a great example of it. So and also equally important is reducing stigma on certain things. And autism, is stigmatized. People, now, when I became pediatrician and I started reading more about things, and then I reflected back on my childhood, I can recognize many people, they were stigmatized. Oh, ye pagal hai, he insane hai. They all were autistic probably. So we missed those windows early on. But I don't want to be, overly optimistic at the same time, and I want to be honest that sometimes whatever you do, it doesn't make a difference. But a lot of times it does make a difference. So yeah, autism is one of the diseases. Unfortunately, it's becoming more visible now because we have better ways of diagnosing it, and in the past we didn't have. And the good thing is we can do something about it. We can at least create as much resources as we can. And I think in Pakistan there is, I'm a little bit optimistic in the sense that there is a growing awareness about it in Pakistan.
Yeah. So what are some early signs that parents need to be aware of?
Yeah, usually it is difficult to pick sometimes when you are in infant age group. Usually it becomes more obvious after 1 year of age. The key area points are like joint attention. Let me give you an example. If I tell a child, look on something, the child should follow my finger and look at that thing. So sometimes they don't have a joint attention. And you cannot have them focus on one thing. And remember, autism is a spectrum.
Yes.
So not a child might be on a spectrum and you might not even know it, because they might be high functioning autism, and they sometimes do really well in certain areas. And there are who are not even verbal. So common sense signs are speech delay, language delay, not taking interest in social cues, not having social smile, those could be some of the early signs. But usually we do perform proper testing after they are 18 months of age, and screening even during that time period or later on. And there is a proper methodology how you do testing and diagnose it. Yeah, for that you need to see obviously a pediatrician or a specialist, a behavioral developmental specialist to call it a diagnosis, so that the child can get all the services which needs to be given.
Yeah. No, thank you so much for, highlighting this important topic, especially during this month. I think like you said, if it's early intervention will probably make a huge difference for both, the child and the parents and the families involved. So, I guess there's also some videos on APPNApede's, again, YouTube channel that, I'm sure families can look out for, especially in Pakistan as well, just so that, we don't miss out on any diagnosis, or there's no delay in diagnosis on that.
So that's a good point. We have not made any videos on autism, but that is something we can think about. But thank you for pointing that out.
Okay, wonderful. Okay, all right. So, pretty much just building on everything that we've discussed, what is your vision for APPNA Pediatrics moving forward?
If I have to say in very straightforward, simple way, is just to strengthen APPNApeds as a platform and that serves its mission with a substance and quality. And I will emphasize on that, the substance and quality. That is the vision. As an organization, we should strengthen it. And this is the direction at strategic level. To achieve it, there are many ways we can pursue it. And I will give two proposals as an example, for example, and that is my vision, and I'm speaking from my heart. For example, the specialty chapters, including APPNApeds and other specialty chapters, they should be part of the APPNA Council, and they should have a vote. I think this will also strengthen APPNApeds or other specialty chapters. The other proposal which I have been pushing for the last few months is that the Central APPNA should create a way where they can sponsor seed funding for the trainees, like residents and fellows, like a $5,000, $10,000 seed funding, 10, 15 seed funding scholarships. So the purpose of those seed fundings will be to facilitate the research of the trainee and residents, and how it can impact. I will give you an example. Let's say I am a fellow and I compete for this scholarship, and that should be open to anyone, not just Pakistani, like across the North America. And I get that scholarship, I do my research, I get publication out of research, I publish, and I acknowledge APPNA as the funding source. You can imagine how much positive impact it will have down the road and generations to follow. For example, I received funding from Gerber Foundation. It's a private foundation, and as a fellow, I was impressed that they funded my research. So every time I publish something, I acknowledge them. So APPNA should do something like that. It will make APPNA visible nationally here in the US, and not just to the Pakistani diaspora. It will extend to non-Pakistani diaspora as well. They will feel like, oh, APPNA funds research, especially when now the NIH has a little bit of crunch on funding. So this can fill the gap. So this is one of the visions I have, because you asked me what is your vision. But those are proposals. I think they can be achieved, and they don't require a whole lot of funding. The only thing it will require is some scientific committee which can receive those proposals and then decide on merit, which can be funded and which cannot be funded. And there are so many competent people in APPNA which can easily handle all that. So
I really hope APPNA is listening to this. I hope these are fulfilled soon. So,
Look, one of the other thing I will say that, we all, despite all the shortcomings in Pakistan's education system made us where we are, debt free, and
yeah,
and one of the ways we can pay back is create and pay back to the system, and collaborate with people in Pakistan, improve their capacity. We cannot fix everything. We cannot fix everything, but we can try. But at the end of
yeah,
day, we will be judged by our efforts, not by the outcome of our efforts.
exactly. 100%. I agree completely. Okay. So looking back at this, 10-year or milestone, I would call it, what do you consider the most meaningful achievement for APPNA Peds in 2025?
Oh, that is a tough one. And honestly, we may not have achieved many things which we envisioned during this cycle. And I want to be honest with you, there were many things we envisioned which we did not achieve, but we tried hard. And our objectives would be to continue our efforts, inshallah. And one of the most meaningful milestones, I would say, during this period has been strengthening the organizational foundation. The hallmark of that was the approval of constitution and bylaws. So after 10 years, we revised our bylaws last year. And I think that was a big success. Our bylaws committee worked on it day and night. They met so many times, reached out to members, and thankfully members approved it. So that was one big achievement, I would say. At the same time, we did many other things like academic collaboration, educational initiatives. We also trying to create more digital content, and we continued our PQ rounds, which Dr. Mehreen started. And, the signing of MOU was also another important milestone we achieved last year. And then we raised funding for the Pehchan project, which is run by Dr. Naeem Zafar in Pakistan. They actually, in 4 areas like Muzaffargarh or other areas, we are sponsoring a maternal child clinic there from APPNA Peds Forum. And we raised funds for that. And we plan to continue supporting them. Then we had, as mentioned, we had a virtual conference, a neonatology, the Quetta conference, which we joined, and then our plans for health education content creation, and TikTok. Let me tell you interesting thing about TikTok. Pakistan has way more TikTok access than other platforms. So we were thinking we will create more content, the health education content in TikTok in local languages. So I'm more enthusiastic about it, honestly. And let me tell you, Sana, one interesting thing here. And interesting and sad. Now, sad in many ways. Imagine United States population 350 million. Pakistan's population 250 million. So US has 100 million more population. You know how many infants die in Pakistan in 1 year? 275,000 every year. And how many they die in US? 20,000. And most of them, they usually have some congenital anomaly. You can imagine the gap and how much we have to work to improve. And same goes with the maternal mortality. And all-cause mortality in Pakistan is 10,000 young female of childbearing age, they die, like due to postpartum hemorrhage, hypertension, or whatever the pregnancy complications are. And that number here in US, where you have 100 million more people, is 700 to 800 deaths versus 10,000 deaths in Pakistan. And remember, those deaths, the 10,000 deaths, those are healthy, most of them healthy childbearing age women. So that's why, and some of those things can be prevented with just common sense things with health education. So that's why literacy was a problem. So that's why we feel like if you can create audio content, even if you cannot read and write, you can listen in your own language. So that can make a difference. So that is the philosophy behind of our enthusiasm about it. And yeah, I think those are kind of some of the things which we have been doing.
Yeah. No, thank you for sharing this. I mean, this mortality, we, I think, pretty much need to, strengthen our primary care. We need to try to, improve like early diagnosis, raise awareness. I'm glad that, you guys are working towards, all these goals. And I really hope and pray that, we can achieve them as soon as possible, because, this is very discouraging. These numbers are extremely discouraging.
You are absolutely right. I will tell you, I think Pakistan doesn't have unlimited resources. You can only focus on decreasing the disease burden. You can end up, as you mentioned, about preventive health. So I think that is an area we have missed the boat in the past, but I think that is area we should put all our energies on if we want to have a better future for our kids.
Exactly. Okay, anything else that you would like to add, Dr. Khan?
Well, I would say, we all share the same purpose overall for our kids, to protect the health and future of our children. And, the organizations like APPNAtube provide the platform where that shared purpose can grow into collective action. So I encourage everyone to join who can join and is eligible to join. And when we collaborate across borders and share knowledge openly and support one another, the impact extends far beyond the organization itself. And the real beneficiaries are and should always be the children and families we serve.
Yeah. No, I really, really appreciate you. Thank you so much, Dr. Khan, for, sharing your experience, for your leadership over the past few years. I'm glad that how this conversation has been very informative and education at the same time, for our APPNA members who are watching, regarding awareness and, early diagnosis, screening, and also not to forget the exemplary work, voluntary work that you guys are doing for APPNA Peds. So thank you so much for your time, Dr. Khan.
Thank you
to
for
everybody
this opportunity.
watching, of course. To everyone watching, we hope this conversation, encourages you to stay involved and support these important efforts. Thank you all for taking time out. Looking forward to what our future APPNA Cafe episodes look like. Thank you, guys.